Hi, I'm Morgan Deegan, the Physio Runner. What we're going to be looking at next with our knee assessment with Tara here is what we call a patella tilt. Okay, so this is important, particularly for those people who've got potential fat pad impingement or pure patellofemoral pain syndrome, which when somebody's referring to patellofemoral pain syndrome, what they're generally meaning is that the kneecap is not sitting within the groove of the trochlea, which is the femur, very well, and you're getting rubbing of the surfaces or impingement of the soft tissue between the patella and the trochlea groove. So in terms of patella tilt, what we're looking at here is the angle that Tara's knee is holding within the groove. So for me to assess that properly, I'll be getting her to move into some knee flexion. So I'll just get you to bend that up for me, thank you Tara. There, and again I'll be looking at the angle that this knee goes. Again, Tara's got quite a healthy knee, so her angle is quite good in through here, but if I'm seeing it acutely going that way or less commonly the other way, then I'll be putting that as an at-risk knee for developing or currently having patellofemoral pain syndrome. So I guess from here, what do we do if we do find somebody who's either got a patella tendon pull issue or a tilt issue? If they've got a significant tilt issue, then taping has been proven to help with those circumstances. However, my history is that rigid brown taping often doesn't hold very well, particularly for people who are wanting to run significant distances, because it simply just falls off as we sweat. Kinesio tape is a version of taping that I've had much more success with, but it does need to be applied to people when their skin is still dry, as if it's got any oil or wet in their skin, then it simply will not hold. So when I'm doing that, I'm focusing on just fixing the tilt issue, so which may change depending on the issue, and that really should be guided by a physiotherapist on what to do with that. Giving general advice for that, unfortunately, is probably not the greatest idea, so I'm not going to do it for you today. So in our next video, what I might show you is how to activate your VMO.